Hi, Neelima. How are you today?
Hi, Rachna. I'm good. How are you?
Yeah, I'm fine, thank you. Thank you for joining us today to shed light on the pressing matter of nurse shortages within the NHS. Your first-hand experiences and
Yeah.
perspectives are very crucial as we'll explore the complexities of this issue and seek ways to address it effectively. So, on to the questions. I'm interested in hearing about your experiences as a nurse within the NHS.
hmm
So, could you tell us about your journey and what it's been like working in such a demanding field?
Well, experience-wise, I've had like 3 years of experience as a nurse.
Hmm.
I would say it's been quite a journey. It's actually a really like an amazing journey to experience, really, like to help out people on your everyday life basis and like, making such a big difference for them. Obviously, not every day is like a good day when we have the shift. Sometimes we do have like bad days, but with every shift, every day we learn something new and like we just do our job, just try to
Hmm.
help people out as much as we can. So yeah, so far I would say it's been like a really good experience and it's a good job, I guess.
Interesting. Good.
Mm.
So reflecting on your career, what has been your most proudest moment as a nurse, and what has been also your biggest challenges?
Um, well, I would say being a nurse itself is like a proud thing to do, proud thing to have as well, because you make such a big difference to people's life. They're really grateful to, for us to help them and stuff like that. But I would say the proudest moment for me has been when, obviously, as a nurse, we get allocated a student.
Yeah.
So we are either the assessor or supervisor, and we are there to make sure that they learn things during placement. So, they can take that on as a future nurse for us. So I still remember when I had my first student, when she graduated, like she messaged me afterwards and she was very grateful, the fact that I taught her some stuff and she would take that on as a newly qualified nurse. And for me, that was like the proudest moment because I still remember myself as being a student and, experiencing that moment and being so grateful of my mentor. And now like I was in her place. Do you know what I mean?
Hmm.
So yeah, it was really great and yeah.
Okay.
And regarding the
Yeah.
biggest challenge that you asked as well, I
Yeah.
would say, when I was like newly qualified nurse, it was very like scary because at that time, like there was always like shortage of staff. So we would be like placed everywhere in the hospital, like in an area that we don't know as well. So it was very scary and challenging because we don't know what that area is like, how the people are
Mhm.
like, and who you're going to work with, what kind of patients you're going to see there. So that was quite challenging. But at the same time, I feel like that was also a point where I did learn a lot because you learn different things in different areas as well.
Yeah. Interesting. How have staff shortages impacted your work and the quality of patient care? So can you share specific instances or examples that illustrate these challenges?
Yeah, I would definitely say lack of staff does affect the quality of care. I feel
Hmm.
like sometimes due to that reasoning, we kind of forget to be compassionate towards our patient because we're so much in a rush to look after other patients as well and do things, like in certain time. So we tend to forget that as well, and it does kind of hinder like the effective care towards the patient. And when there's lack of staff, it becomes more stressful in the environment, and I feel like that way it just kind of like affects the nurses and the staff, whoever is there, like affects them mentally as well. So
Hmm.
I feel like that's one of the biggest tackle that we have in NHS.
Yeah. What key factors do you think contribute to staff shortages?
Um, I would say it's the workload as well, like loads of work to do. It's like physically demanding, mentally demanding as well. And I feel like due to that reason, most of people don't really look after like themselves really well. So they kind of tend to forget that and they overwork sometimes and they tend to call off sick. And during that time, it's very hard to manage that bridge between the gap that we have when there's no staff.
Yeah.
So that time is very, very difficult for us as well. And yeah, I just feel like a lot of people don't really want to work in NHS anymore because I feel like there's not much benefits to it and the pay is not that great. There's not much incentive to it, I guess. So I think that's one of the probably the main reason why people have like staff shortages as well.
Mm. Reflecting back to your answer, what initiatives or strategies do you think could help address the NHS staff shortages? So any approaches or systemic
Yeah.
changes that you believe could make a significant difference?
Yeah, like to my previous point that I mentioned regarding there's no incentive towards like,
Yeah.
applying for this job and stuff like that. I just feel like one of the main reason now is like we don't really tend to have a lot of like nursing students now. One of
Mhm.
the main reason I feel like is because a couple of years ago nursing used to be free. There was a bit of bursary for the students as well. But I feel like now because those courses are not free anymore, a lot of people don't want to take onto that course because, even after you become a nurse, the pay is not that great, as we all know.
Yeah.
And yeah, so I feel like that's one of the reason why there's not enough nurses for sure. The other ones, I think if the government was to like obviously help that and bring that back again, I feel like more people would be eager to apply for it.
Mhm.
The other thing we can also help with the shortage of staff is probably like, having overseas nurses, because in our trust we tend to have that as well. And I feel like that has helped us quite a lot actually. So if a lot of like other trusts starts to introduce that a bit more as well, I think that would be like very good as well. And it would be a good opportunity for the other nurses from overseas to come here and learn different things and see different types of like how healthcare works, I guess. Um, and also I'll probably say lastly, sometimes like some hospitals they tend to release like bank shifts, which are called like extra shifts. So sometimes I feel like if they tend to release that more, like people who are able to work extra shifts and they want to work extra shifts in different areas, they can
Mhm.
go and apply and do that job. So I guess that kind of like fills in the gap for the like staff shortages during that period as well. So I think that's quite useful.
Thank you. Yeah. So, I sincerely value the chance to gain knowledge, from your experience and wisdom. Without a
Yeah.
certain, your personal perspective will motivate, hopefully will motivate, your colleagues and support continued initiatives and alleviate the shortage of nurses within the NHS and hopefully elsewhere too. Yeah, so again, I want to thank you for giving your time to us. Thank you very much.
Yeah, thank you for having me.
No worries.